How to prove a birth injury in a personal injury case. Hello and welcome. In this video, we are discussing how to prove a birth injury in a personal injury case. Birth injury can have long lasting impact on a child and their family, and it's essential to know how to build a strong case for a compensation if you believe medical negligence was involved. Whether the injury happened during labor, delivery, or shortly after birth, knowing the right step to take can make all the difference. Let's dive into how to prove a birth injury and get the justice you and your child deserve. Step 1 is understand what constitutes a birth injury. Before we can talk about proving a birth injury, it is important to understand what constitutes a birth injury. A birth injury is any physical harm caused to the baby or mother during the process of childbirth. This could result from oxygen deprivation, example brain injuries like cerebellar palsy, and forceps or vacuum delivery, which can cause fracture or nerve damage. And third is improper use of medication during labor. And fourth is failure to recognize fetal distress. And last is delayed delivery or inappropriate delivery techniques. In case where the injuries occurred due to medical negligence or improper care, you may have a personal injury claim on your hands. And step 2 is gather medical records and evidence. To prove a birth injury, you will need to collect as much evidence as possible. This includes obtaining first is medical record, request complete copies of your parental care record, labor and delivery record, and any post-birth documents. This will show the care provider before, during, and after the birth. Doctor notes and observation. Look for signs that the healthcare provider may have made a mistake or failure to act appropriately. For example, if they missed sign of fetal distress, this could be important evidence. Test result. Get access to any ultrasound, blood test, or imaging scene that we are taken before or during labor. This can help show if the baby was at risk before birth. And fourth is birth detail. The delivery itself, including how long labor latest, the type of delivery, and the use of instrument like forcep or a vacuum, are critical pipes or evidence. And step 3 is hire an experienced birth injury attorney. A birth injury case is complex and proving negligence requires a specialized legal expertise. Hiring an experienced birth injury attorney is crucial because they will understand the medical terminology and procedure involved and have access to expert witnesses like medical professionals who can testify to the standard of care and be able to navigate the legal complexity of proving negligence in medical setting. Consulting an attorney who is specialized in birth injuries can help you determine the strength of your case and whether you have a valid claim. And step 4 is medical expert testimony. A key part of proving a birth injury case is getting the testimony of medical expert. These experts, such as observations, pedistri- pediatricians, or neurologists, can help establish the following. First is the standard of care. They will testify to the accepted practice in labor and delivery and how the healthcare provider fell short of these standards. And caution. They can explain how the action of the healthcare provider directly lead to the birth injury. For insurance, if the child was deprived of oxygen, an expert could explain how that caused brain damage and future impacts. Medical experts will also discuss the long-term effect of the injury, including potential cost of care, treatment, therapies, and a special need that may arise. This expert testimony is critical to proving negligence and showing how the injury directly resulted from substandard care. And fifth is establishing the link between negligence and injury. To win a birth injury case, you must prove the medical negligence directly caused the injury. This is often done by showing. And first is a breach in the standard of care. Medical provider must act according to established guidelines. If they deviated from those guidelines, this is negligence. And second is caution. You need to show that the breach in care directly lead to the injury. For example, if the baby's oxygen supply was cut off during delivery, you would need to show how this caused the injury, such as brain damage or cerebral palsy. And step 6 is documenting the long term impact of the injury. The long term impact of the birth injury is an important element of your claim. In addition to medical records, you may need to show how the injury affect your child's quality of life, development, and future needs. This could involve therapist and treatments, educational needs, and emotional and financial cost. And step 7 is filing the claim and negotiating a settlement. Your lawyer will work with you to assess the damage, including medical expenses, emotional distress, and future care cost. Having a strong evidence, expert testimony, and a clear understanding of the injury's long term impact will strengthen your case. To summarize, proving a birth injury in a personal injury case requires careful documentation, medical expert testimony, and establishing a clear link between negligence and the injury with the help of an experienced attorney and medical experts. If you found this video helpful, don't forget to like, subscribe, and comment with any question to have. Thanks for watching.